Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeannie White is the producer, writes the blog, which I hope you read. And Lillian Caldwell is the CEO. Here at Passionate World Talk Radio, we educate, enlighten, and entertain. I just want to do a public service announcement. It is still November, National Alzheimer's Awareness Month, and National Caregivers Month. Please love up on a caregiver, not just this month, but all year long. They will deeply appreciate it. Folks, you're going to want to listen to this podcast. You know, here in America, we know our healthcare system is broken, but we think that the grass is greener over in Canada. Not necessarily so. And my guest, who I'm so excited to have, wrote a book called, let me take my glasses off, Made to Live, and also did a video. I encourage everyone, go on YouTube and look for Made to Live about Dr. Saba's daughter. It's heart-touching. And I want to welcome Dr. Paul Saba, author of Made to Live. I can't wait to hear you, Dr. Saba. Welcome to Chatting with Betsy.
Thank you so much, Betsy. Greatly appreciate you having me on your show.
You're welcome. I always ask the authors, why did you write the book, and what would you like the reader to come away with and from reading your book?
Really,
we'll start with that.
The book is really an expression. It's kind of a conversation, like if we were talking, like we're talking now, and I try to write in that style, you asking me questions and me answering. It really is a fruition of all my years of working as a doctor. I'm actively practicing in Montreal. I'm a dual national. I'm an American and Canadian, born in Canada, but I practice over 12 years in the United States, in Massachusetts, North Carolina, a short time in Oregon. So I've sort of traveled. My mom's originally from Portland, Oregon. She's 93, and thank God she's very active still, despite, like everyone who gets older, you have health issues. And I've seen my family growing up in Montreal. I've seen my patients going through different health challenges. And really the story that really touched me the most was what happened with our daughter, Jessica, who's now 11 years old. And that really gets capsulized my writing the book. And even the title, Made to Live, came from Jessica because when she was 7 years old, I, like all children who love to be on the computers, I tried to get her off, so I gave her some Crayolas, and I said, honey, why don't you draw a picture of our family? What she did is she put down the Crayolas, and she went on the computer and went and drew the portrait on the computer. When she did the picture, she did ma, pa, sis, bro, because she has an older brother and sister, and then she wrote me, Jessica, in very large letters, and you'll see that in the book. And on top of it, she entitled the picture of her family Made to Live. And I was just really blown away. And I just said, honey, I said, where did you get with that? She says, I don't know. I just wrote it. And then you see in big letters, me, Jessica. So she was really telling the story that she was made to live. Like everyone has been made to live. We're not made to die. And I brought in the subject that I've been fighting against. I've been a person who's promoted life, whether a person before their birth, after birth, and during their long journey. Because there's also a big debate not only on abortion issues in Canada and the United States, but also on assisted suicide or euthanasia. And
yes.
And I've spoken. I've been invited to speak at various hearings in the United States. I've been in New York. I've been to Connecticut. I've been in New Hampshire, and I've spoken at state legislatures. And I'm really warning people, don't follow what Canada, because Canada has gotten a very wide open policy on assisted suicide and euthanasia. so that they're now even introduced, and it's going to probably pass because the government under Trudeau is a majority, and they're going to extend it to people with disabilities. So you don't have to be. You could have 20, 30 years ahead of you, but if for some reason you're feeling frustrated by life or by the challenges or discouraged or depressed, you can get you can be put down like a dog. And I've always said, people don't want to die. They just want to have a comfortable life. And when people say, well, I want to be injected, they're really, it's a cry for help in most cases, is because they lack hope. Even if they're given a bad diagnosis, which is never a guaranteed outcome because we don't know. Doctors make errors 20% of the time and tell you have cancer. And I talked about patients who didn't have cancer, were told they had cancer, who could have been injected and could have died. But they for some reason they decided not to. And then people being told that you only have 6 months or less to live, and we're wrong half the time in prognosticating who's going to live and who's going to die. So really, that's really what the book is about. And I give stories about my patients. I talk about my life's experiences. I talk about abortion, and it's not in a way to cast stones or to critique women who have gone down that path and who have regrets, because I even talk about having accompanied a woman to an abortion clinic years ago, and I live with that regret. So basically, my story is there to encourage people to give hope and to allow people to think there's alternatives out there than ending your life prematurely.
What I found fascinating, Dr. Saba, is when I was watching your video, and I'm an emotional person anyway, so I did cry throughout the video, was that your precious daughter, the doctors wanted your wife to have an abortion.
That's
because,
right.
And your daughter is fine today.
Yeah, I mean, and that's really the story, because we never can know outcomes, and there's no guarantee. Things could have turned out, and the doctors could have been right that she wouldn't have survived, or, but, when my wife was 20 weeks, this was our third child. It was interesting because we had what everybody calls $1 million family. We had a son and a daughter, perfect life. I'm a doctor. I live close to the water, and I have a good practice. I have a good life. And why look for problems, as people will say, But when they told us that the third child, and we decided we wanted a third child, we said, you know what, there's someone missing in our life, and we just knew it, both of us. And when at 20 weeks, when they did the routine ultrasound, they came up to us and said, you have a problem. I said, what do you mean a problem? And they said, well, we looked at, and there's definitely a heart defect, and she's your child, but you have a girl. They told us that, and she's probably Down syndrome. And but we want to really do another test in 4 weeks, which we did. And when you're faced with that, you pray for things to change. I'm a Christian. Am I a perfect Christian? No, I don't think there's any perfect person who practices her faith, whether it's Jewish, Christian, or other. But we prayed and we said, please, God, don't let this, you can, because I believe miracles happen. I wish there were lots more. But we were told, no, 24 weeks, definitely there's a heart problem here. And if you're going to do something, you should do it now. And I said, what do you mean, do what? They said, well, what we're talking about. And they were talking about, the options was because in Canada you could have an abortion anytime during the pregnancy, right up to the day before the child's born. And we said no. And my wife, who when they continued to call her, and she probably expresses it a lot better than I do, but they said, they kept calling her, and they said at the end, they said just before Jessica was to be delivered, they said, and if it turns out that she's born, and what do you want us to do? Because they kept saying she's not going to have any quality of life. And And it was like, she's, having trouble breathing, and which was for sure because her heart was only half formed. She only had really her left heart that was properly formed. The right heart was only half formed. So he said, my wife, courageously said, I've done everything to get to this point in the pregnancy. You're going to do everything to save her. They were even clear. They were even more dramatic. They said, and if it's between your life and your daughter's life, they talked to they're talking to me. And my wife answered. She says, no, you do everything for her. I was like, I was blown away that my wife was so committed to our little daughter, She did have a cesarean. It was just caught in the nick of time because because it was her third cesarean, so the wall was actually coming apart. There is a certain risk. And they took amazing care of her. She had amazing care. She had 2 cardiac interventions, and now she can do everything that any child can do. And the cardiologist, when he sees her, because he says, I don't really need to see her anymore. I said, well, my wife feels better just going there, once a year just to check on things. He said, if I didn't know that she had a heart problem, I would have never predicted this, if I didn't know this, So I basically the story says not everybody has the same outcomes, and there's no guarantees in life, and it could have turned out that she, maybe she wouldn't have, but she did survive, and she's done amazing. But unless you give life a chance, you never know. And that's really what, if you want guaranteed outcomes in life, perfect life, perfect this, perfect that, you're going to miss out on life.
That's true. I think, Dr. Saba, that I feel here in America that it's a throwaway, disposable society. And that, you have a disability of whatever the case may be, then, just abort the child. Now, I'm not here to say, whether to abort or not. That's a personal decision, or assisted, suicide. I personally couldn't do it. Assisted suicide by a physician. That's to me. I understand the concept of why a person would do it, but I personally couldn't do it. Do you feel, because I see this coming with the baby boomers, and I'm a baby boomer, and with Alzheimer's on the rise and other health conditions, do you feel as a physician that this is going to come to be, that we're going to just be disposing of people, whether they want it or not?
Well, it's already, with the COVID, because people, I've heard, the debate, and I've been to even court in Canada, and it was interesting. Once you challenge those in power, they try to silence you. Because in court they said the Attorney General of Canada in Quebec, which is the province where I live in, said you're not allowed to present your arguments. And my attorney says, why can't he present it? Well, because he's against it and he can't be objective. Well, obviously, if I was for assisted suicide euthanasia, I wouldn't be contesting it. The judge didn't uphold their arguments, but just to show you how powers and be will try to control and suppress opposition. And if you look at what's happening, people argue, well, it's voluntary. It's voluntary. Voluntary to what point? Because there's even, if you look in the New England Journal of Medicine this year, during the COVID crisis, they were saying because of lack of resources, we're going to have to come up with criteria who can be on a ventilator, who could get into an intensive care unit. And they were saying that the criteria needs to be set up. And they went so far as to say the Ontario Health, which is our largest province, Canada, said it's too difficult for people to make that decision, doctors to make the decisions, and families. So administrators are going to decide. We're going to set up the criteria. You're not going to even know. You're not going to even, if you want to get into the intensive care unit with COVID, we're not talking about somebody with a disability or somebody, Alzheimer's. We're just talking a regular Joe Schmo citizen who they're going to give you a rating. If you can't make, in Ontario Health, they say if you don't make 70%, then you don't get cared for. You die. Basically, if you've got a serious thing like COVID, and that's like, for example, if you have high blood pressure, diabetes, a little overweight, I think even certain cultural groups, if you're Afro American, you're higher risk. So I mean, who knows what numbers they're going to put into the computer and come and spit it out, So
wow, so that's scary.
Well, that's already. We're talking New England Journal of Medicine. We're not talking about some conspiracy journal or magazine.
Right.
So this is May 22nd.
I've heard that. Wow.
Yes.
Yeah.
Yeah, the 70%, I think that was out of Ontario Health. So I don't think the New England Journal went to that. This is a group of outstanding medical people. So what I'm saying is, don't go that way. Don't legalize death. Don't allow the government. It's already in quite a number of states in the U.S., assisted suicide, and it's just going to expand. It's expanded in Canada. It became legal in 2016. It was only supposed to be for those who were terminally ill with only a short time to live, whatever that short time was. And I remember people were saying, we're only talking about a handful of people. Now they've done over 15,000 in the last 4 years in Canada, and even depressed people and people with handicaps. And now they're going to legalize it for very shortly. And they're talking, and some are talking about children. They want to expand it to children as they do in Belgium and in Holland.
Wow. I was going to bring up that Belgium and Holland, the Netherlands, that they do euthanasia, and the person who they're giving the injection to has no say. If the family says that's it, we want that for our loved one, then that's it. I mean, that's really a scary concept.
And it's interesting. I bring up the whole issue of even in children, and I talk about 2 children in Belgium who were given euthanasia for cystic fibrosis, and there's a new treatment that cures it. And that came out like very shortly, or maybe even around the same time that these children were put down. So there are new treatments that come out, and we never know. Even with COVID in the United States, we have the vaccine. I'm not going to tell people what type of vaccine to take or not to take, because I'm not sure what side of this. We have actually a good vaccine in Canada, which Medicare. I'm not pushing it. I'm not a member. I don't have stocks in the company. But it's just the protein code. It's not a live virus. I'm a little reluctant to live viruses, but I'm not telling people not to take that. But there are some good things that coming around the road, around the corner. And you never know what's around the corner. You never know a new treatment. And for Alzheimer's, and I know you're very involved with that, Betsy, we should be investing in research. Look at how in short order we're able to find the vaccine for COVID. Imagine if we put the same amount of money and energy for the millions and millions of people in the United States, Canada, and around the world who will be faced with Alzheimer's. We could find a cure. It's just a matter of will and willingness. And for lots of these neurological diseases, I talk about Lou Gehrig's, I talk about multiple sclerosis. In fact, my daughter even wrote a chapter in the book, she's 16 now, on these neurological diseases and children's health in the developing world. But I think we're capable. It's just a matter of will, If we go down the road towards life, because I really believe we're made to live, I didn't go into the story of Adam and Eve in the garden, because I believe, that story really sort of capsulizes that man was made to live. But, eating, I always say he ate some bad food, the apple, and it basically poisoned them. And you can use that as an allegory or as a reality. I love talking about that story, because I just show it's human nature. You say don't do something, you tell your kids don't do it. It's not good for you.
Right, they'll do it.
That's right. They eat definitely some bad food. But the whole idea of mankind is we're there to help each other, support each other. I give the story of the Good Samaritan, which is a story of which many of our laws are based on in the United States. Healthcare laws are based on. We're supposed to help our neighbor. There was a story of a man left half dead on the side of the road, and everybody passed him up except the Samaritan, who was part of a Jewish traditional group, but probably not highly respected by some groups. But he stopped on the side of the road, did first aid, bound up the wounds with wine and olive oil, and took him to the inn. And he paid the money. He said, any more that I owe you, then, take care of him when I come back. I'll pay whatever more I owe you. So this guy was left for half dead. He would be the ideal candidate for assisted suicide. But we're never supposed to abandon these people, whoever it is. And we never find the end of the story. We don't know if the guy survived or didn't survive, but that doesn't matter. We're supposed to care for one another because we're part of the human race.
Yes. And how do you feel, Dr. Saba, about universal health care? Is it all that it's cracked up to be? Because here in the U.S., like I know my health care is the supposedly affordable health care, but it isn't. So people here in America think that universal health care that you have in Canada and in Europe is better. What is your opinion on that?
I think the United States is quite capable of coming up with a program to ensure that everybody has health care coverage. I recently looked up. I know whether you're for the president or against the president. To me, it doesn't matter. But he did sign an executive order ensuring that everybody should have health care. He didn't go through it, but I think the United States is quite capable of coming up with a program, private, public, mixed. Just make sure everybody's covered, whatever it is. Come up with the United States. I mean, that's my American coming out. Americans are quite capable of coming up with the best plan and figuring out across the divide between the Republicans and Democrats. They need to come up with a solution so that everybody's covered. It's not perfect in Canada, far from perfect. I had a patient who last winter was waiting for months to get her heart surgery, which is quite operable. She had a valve that was blocked. And she died waiting. I mean, I called and I pushed, being a doctor, and I'm also president of our council of physicians, so people know me, so if I pick up the phone, they'll listen. I mean, do we have influence? Yeah, we have undue influence sometimes without wanting to, but we do. And I couldn't get her. I couldn't move her up because there's a lack of beds. And the cardiac surgeon just apologized to me. He says, Paul, I'm so sorry. He says, we just don't have the beds because the government cuts back on beds because they're trying to balance the budget. And, and I don't see that would have happened in the United States. On the other hand, my daughter got amazing care. So, you are able to do in the United States. And I don't think one solution fits all. I don't think you should. I've never believed in, throwing out the baby with the bathwater.
Right.
Breaking down your system and adopting another system. No, just shore up, improve what you have, make it better. But don't jump to the Canadian system. I don't think that would be wise. I think that's silliness. It's stupidity. It's improve. I mean, I did when Americans back in 2001. There was a complaint about the high cost of medications. I saw a group of Americans who came from New England, and I offered them they wanted to buy cheaper drugs in Montreal. This was like almost 20 years ago. And I saw them. I filled out the prescriptions. I didn't charge them, so they, because I believe that you need to have affordable medications. I'm a strong advocate to ensure everybody has health care. I say health care for all rather than Medicare for all. Health care means just find the right solution, get everybody covered. You have your private insurance, keep it. If you lose your private insurance, find a way to ensure that you get some type of insurance that you're covered through public, private, or a mix. That's what I've always believed. But this whole idea. I mean, we even talk about manufacturing. I remember I've spoken out for years against closing down manufacturing here in North America and offshoring it. I said, they said, well, we'll build airplanes and computers, and we don't need to make clothes and shirts and do menial work. I said, no, people, not everybody's going to be a brain surgeon. Not everybody's going to be an aeronautical engineer. Make sure you keep the jobs for your local population. And pay a little bit more for clothing, pay a little bit more for this, but, help your population. Because if people are poor, their health is not going to be so good. So, and that study's been shown. You live 7 years shorter, less. Here in Montreal, they showed a study with people living on one street versus another side of the street, 7 years less long because of poverty. So, we have to make sure people are working. We have to provide people good health care. And in the United States, I believe you can do it. I don't think you should just jump on one bandwagon or another.
Well, thank you for that perspective. I find, and I have heard of people in Canada that come down to the U.S. to get MRIs because there's a waiting list. And also in Europe, the shortage of beds, there's not enough staff in the hospitals. You have to take care of your own loved one if you're, in one of those hospitals where there's no staff around. And there has to be a solution. I really myself don't have the answers. I just know as a consumer, the out-of-pocket cost is, outrageous. And I feel, Dr. Saba, that we shouldn't have to, nobody anywhere should have to go bankrupt to get medical care. There's instances here in the U.S. where people get divorced. They still live together, but they get divorced to protect their assets so they could get care without going bankrupt. And that's wrong.
I agree. I think that you find a solution, list all the problems. First of all, you want to make sure that everybody gets quality care. You don't want to be waiting for there's no point to tell people we'll give you free care, but you die on the waiting list. That's
right.
That's not good. On the other hand, when people have access, you don't want them to go financially bankrupt and destroy their lives and family. And the United States is rich enough. Look how much has been spent, with the COVID closures and the trillions and trillions of dollars. You can find a solution that ensures, wise people, those who are working, have private insurance, those who, and you'll sit down with the insurance company and say, come on, you guys, you can't be charging people, so much that they go into bankruptcy. Sit everyone around. I mean, with the COVID crisis, you're able to manufacture vaccines in like a short while, build ventilators, mind you. Car companies making ventilators. So, I mean, the United States has got the wherewithal to do it all. I think there has to be will. It can't be political. It's like, we'll get more votes for this party versus the other party. We'll hold off. No. Help the people. I've always believed if you help people, help one another, you'll build goodwill, and the idea is the good for everybody. It's like my whole argument about not aborting your child. I think in the long run you're going to feel better about it. You're going to feel good about it. And if you're poor and you think I can't afford it, we have to help people, women who want to have babies but who for whatever reason feel they can't afford it. And for those who find it as inconvenience, we have to convince them, well, okay, you really don't want a third child? Well, maybe you can, out of kindness for somebody who can have a child, you can give it up for adoption. And then for people who are facing the end of life and say, listen, I don't want to, the prognosis is bad. I may die anyway. Listen, stick around at least for your family and just for, because we never know, what impact that has. And because if you persevere and you don't give up, then it encourages others not to give up.
And what would you say to someone who has a incurable disease and their outlook isn't good and there is no cure, like Alzheimer's, for instance? I believe in providing, comfort.
That's right.
Could I could not have had my husband killed. My husband died January 1st from a 10-year battle with early onset Alzheimer's, and he got comfort care. He was in hospice. I couldn't have done it. I don't like to say I'm a religious person. I am a Christian, and I believe God takes the life when it's time to take the life. Whatever anyone else decides, that's between them and their maker. But I couldn't do that. I believe in making a person as comfortable as possible. And, Dr. Saba, I feel, and I never was a hippie, but, it's not a Democrat or Republican here in the U.S. issue to me. To me, it's a human being issue. It doesn't matter whether what your party affiliation is. We all deserve quality medical care without going bankrupt. And it's just a human being issue, and that's how I feel about it. I
agree with you, Betsy.
Yeah.
I agree with you, Betsy, and I think, just caring for people right to the end, you'll never have a regret. We took care of, I remember my aunt who was she was in her 90s, and she taught me piano, so she stayed at my sister's, and my sister was able to care for her at home, and we got help in. But she got multiple pneumonias. We had her out of the hospital. In the end, my sister said, Paul, what should we do? Shouldn't we just keep her home? Why send her back to the hospital? I said, yeah, okay. Whatever fluids she takes. What antibiotics she'll take. And she died quietly and comfortably at home. And we never, we did the best we could. At a certain point, I'm not saying you have to admit person to the hospital every time or you have to put them on a ventilator. No. There's a time for everything, but you give the best care you can. You try to get fluids into them the best you can. You offer them something to drink, something to eat, and if they go off, and they meet their God at some point, that's fine, But that's very different than taking a needle and saying, you know what, we're gonna take them out now, because for whatever reason, because the family's uncomfortable. Or because as long as they're comfortable, and we have the medical means to treat every ache and pain, and people are afraid to say, well, if I give too much morphine, isn't that the same as killing them? I said, no, because if you adjust the morphine, for example, to their pain, studies show that you don't shorten their life. In fact, you increase their life because they're more comfortable, they're more likely to eat and drink. There's no guarantee, right. There's no outcomes. And we never know when there's a new treatment. And in the meantime, we should be doing like the Good Samaritan, taking care of that person that's half dead on the side of the road.
Absolutely. Dr. Saba, I enjoy talking to you so much. And thank you for taking time out of your busy day to come on Chatting with Betsy. Where can people buy your book?
Well, it's sold at Barnes & Noble in the United States. They can also go on our website. That might be the easiest, madetolive.com, all one word, made to live. Amazon is also on Amazon. But if you go madetolive.com, you'll be able to see the book. You'll be able to see the video. And then you can click onto Amazon, Barnes & Noble, and purchase the book or write directly from the publisher, whatever is easiest. madetolive.com.
And I want to encourage everyone to watch the video because you will be if you're like me, you'll be in tears. It was such a precious, inspiring video that when I watched it, I was like, oh, yes, I have to have Dr. Saba on. I mean, this is incredible. And I have heard from other people also. They were told that their baby had a severe heart condition or that their baby had Down syndrome to abort it, and it turned out that the baby didn't have Down syndrome. They might have had a congenital heart problem, which was fixable, but
and every child
is a gift.
Can be loved, is a gift, and we never know the outcomes. Our child didn't have Downs, but we were going to love the child regardless. And you just don't know outcomes. And take every day, a day at a time, do the right thing, and leave the outcomes to God. That's what I always tell people.
I agree. And if people wanted to get in touch with you, Dr. Saba, it's madetolive.com. They could get in touch with you there.
They can even write, or they can write Paul Saba at Made to Live, PAULSABA, at madetolive.com. I think it's .com. I'll have to look. I think that's I think that's the email. It's on the website too. or you'll find that the publicist is there too with her email on maydtolive.com.
Okay. Thank you so much. Once again, Dr. Saba, here in America we think the grass is greener, over on the other side of the border, and, universal health care has their problems also. No healthcare system is perfect, but I have talked to doctors here in my area, and they have admitted that the healthcare system is broken, which it is and needs to be fixed. But I'm not smart enough for the answers, so I'll leave it to the people who are. I want to wish everybody a happy Thanksgiving, and in a world where you could be anything, please be kind, be safe, wear your mask, keep your distance. If you missed any of this podcast, you can catch it on Amazon Music, Apple, Google, and wherever you hear podcasts. Subscribe to Chatting with Betsy so you don't miss shows where I have very important guests like Dr. Saba giving valuable information and resources that you can learn from. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Till we chat again, be blessed. Bye-bye, everybody.